Welcome to Health Scope on your darling station NTA Ilori, the station of harmony. I am Olabisi Yusuf and the program is Health Scope, where we answer all of your questions concerning your health. If you have any question or any suggestion, do well to send us a message on the number on your TV screen. Today we're looking at the 2025 World AIDS Day. World AIDS Day comes up every December 1st annually, and it is very imperative for us to look at it on the program today. The theme for this year's World AIDS celebration is Overcoming Disruption, Transforming the AIDS Response. This focuses on the need to address the funding crisis and disruptions in HIV services. Join me as I welcome Professor Taiwo Aremu. He will be taking us through HIV awareness, prevention, testing, and counseling, as well as anti-stigma.
Today, we would be talking about AIDS in commemoration of the World AIDS Day. It's happening on Monday, December 1st. And the theme for this year is Overcoming Disruption, Transforming the AIDS Response. In plain language, despite the funding issues or the funding shocks we all know about, despite the conflicts we have in our community, despite the other setbacks you all may have experienced as an individual, we have the tools to end AIDS as a public health threat. If we all can just protect the services that we currently have, if we all can work together to fight stigma, and if we can bring care closer to you people. HIV is the virus. AIDS is the late stage of HIV disease that can happen if HIV is not treated for a very long time. Doctors call it AIDS when your immune system or when the mechanism that should help you fight disease has become very weak. That's when we say it is AIDS. In those instances, some of your organs might be shutting down, the kidneys may be affected, and several other organs in the body. And usually, in the clinical sense of it, those that work in the laboratory would know. They would say you have low CD4 count. When your CD4 count is very low, then they would say your immune system is poor or is weakened, and then AIDS starts setting in. And in many instances, those who have AIDS would have very serious infection. Imagine the usual malaria that we all just have on a routine basis, and malaria is now making you look bedridden. You cannot do anything. And then before you know it, you can no longer use the bathroom, and then before you know it, the person has to be admitted, and before you know it, they're like, whoa, this person is about to die. Something might be off. It might just be that the immune system is very, very weak. But here's a simple journey that I will share with you, even without treatment, or most instances when you don't treat. There is the early weeks of having the infection itself. Some people might just feel they have flu-like symptoms, like they are coughing, they have mild fever, they are sweating, they are having running nostrils, what you call kata, all right? In those instances, it means that the virus in the body is very high. And then there is this quiet phase that happens where the virus is just working very slowly. You feel very fine, very healthy. Nothing is happening for years. But the damage is happening internally, little by little. And then there is the late stage that we call AIDS. 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 In that instance, the immune system is very weak. The soldiers in your body that should help you fight the infection is already weakened. And in that instance, the body cannot fight other kind of infection. Little infection will start, making the day. But with today's treatment of HIV, most people can live a normal life, actually. You can live your life like every other person, even if you have HIV. But when treatment stops, for those who have the virus, then the immune system can begin to get very, very weakened. And of course, that's why we need treatment, so that Even if you're sick, you can quickly recover and life can move on. Please don't forget, HIV is the virus. AIDS is the damage HIV can cause if HIV is not treated. HIV is not a death sentence, so never. Decades ago, several years ago, treatment for HIV itself was very limited, and in many instances it was hard to take. I've interacted with some patients who will tell you, doctor, that medicine is not easy. But today, HIV is a manageable condition. Even though it is chronic, when I say chronic, I mean it can last, it stays for a very long time, but it's very manageable. With the right treatment, if you use the correct medications, then you can lead or you can live a normal life like every normal person. But there's a trick. You need to start treatment very early. And when you start, you have to be very consistent. You cannot stop. Or you cannot stop when you feel like. You just have to continue. People that are living with HIV can live a very long and healthy life. In fact, better than so many people who don't even have HIV. Yes, we have many of them in our community today. They can continue to work. They can continue to go to school or study. They can continue to raise their families. They can as well plan for the future. So it's not a death sentence. There is also a powerful message that is called you is equal to you. You is you. All right? That means undetectable HIV is equal to untransmissible HIV. So if you have the virus in your body or in your system and it's not detected, that means you cannot transmit it. But how can it not be detected? It's only if you use the medication, or you have to use it very early, and you have to be very consistent. That way we'll keep the virus level very low. If it is low, then you cannot transmit it to someone else. Take note, when someone who has an HIV continue to use their medication, the virus becomes undetectable in their system. That way, they cannot pass the HIV to their sexual partners. That's science, right? And that's very liberating. Please don't forget, on treatment, people live very long and fulfilled life. And that way, they cannot transmit the virus to their partners. HIV spread through specific body fluids, through blood, through semen, some of you want to say sperm, all right, through vagina and of course rectal fluid, and even through breast milk. And that's why babies who are born to mothers who have HIV, if care is not taken, those babies can also get the virus from their mom through breast milk. But of course, there are different instances where that can pass on, but that's not the emphasis right now. But let me just talk about it. If there's a crack on the nipples, for example, if there's a crack and baby is sucking on the nipples, then there can be transmission of blood, through that crack. That way babies can easily pick it. So you get that. But the main ways people actually get infected with HIV today is through sex. Not just sex without protection. When you share needles, for example, and then of course, like I said earlier, from mother to child, especially during pregnancy, during delivery, and during breastfeeding, if preventative care is not given to those mothers. Just as important, you cannot get HIV from a hug. No way. You cannot get HIV from handshake. Even when you share meals together, you share your food, you cannot get HIV. No. You cannot get HIV from mosquito bites. Everyday contact, your everyday life where you have contact with people in the taxi, at work, in church, in mosque, wherever, in the market, is safe. You cannot pass HIV to one another that way. Don't forget, HIV only spread through specific body fluid.
Thank you, Professor Taiwo Aremu, for the enlightenment so far. At this time, we'll take a short break. Don't go away. Health Scope continues. You're welcome back. In case you're just joining us, we're discussing HIV awareness and anti-stigma, and Professor Taiwo Aremu has been doing justice to that. Right now, he'll be taking us through the management of people living with HIV.
There's what we call antiretroviral therapy. We call it ART. And it's the combination of medicines that can stop the HIV from multiplying. When the virus in the body is suppressed and the immune system, the soldiers in your body, get stronger, then people can live or can stay healthy. And as we said earlier, you is you. So that means you can't transmit HIV through sex when the virus is low in your system, is undetectable. Undetectable is equal to untransmissible. The modern day first line treatment is typically just one pill per day. You use just one medication, one tablet per day. And it's often well tolerated by most people. A lot of people will use the medication and not have any issues. You know, the usual way you wake up in the morning, you drink water, you eat your breakfast. That's how it is. Just take one. For me, I would even tell some of my patients, take it like a supplement and just take one per day and live your normal life. Services to prevent or to treat HIV itself has improved right now. Many clinics would offer you multi-month refills. You can get your medications as often as you want. You can have fast-track visits to the clinic. You can even, it just depends. There are so many non-governmental organizations right now that can provide you help. For HIV now, there is what we call long-acting treatment, where for some people, all they just have to take is, they have monthly or every 2 months injections that can keep the virus really, really, really low or suppressed or asleep in their system. So those kind of medication help people who struggle with taking daily pills. And then we have the long-acting prevention, which we call PrEP. So beyond daily tablets, beyond daily medications that you take, there are injections for prevention, right? Once it is taken every 2 months, and then you have the ones that you take twice a year injection for global health reasons. And there is this instance for the sake of prevention. Let's think about doctors, for example, or nurses or lab scientists, people in the healthcare who by mistake, maybe they are trying to take blood from someone who has HIV and they inject themselves, for example. They feel they are exposed. Then we have PrEP, we have medications that they can use to just prevent the virus from at least, waking up or whatever. If the virus gets into their system, then they can prevent it from replicating or expanding in there. Not everyone has to take medications every day, all right? So there are medications you can take just a few times a year. And you just have to know that even though we have those medications to keep HIV low in your system, there is no universal cure. HIV is not curable, but it is manageable. So you can live a normal life even though it is not curable. Early diagnosis of the HIV virus in your body can help us start treatment very early. Imagine if some people say, okay, if I wake up very early, let's imagine you wake up very early, then the likelihood of you getting to work early is high, all right, if you wake up very early. And so if you have testing or you test for the virus very early, then you can start treatment immediately. You can protect your health, and you can protect the health of your partners and your babies, your loved ones, your neighbors, your friends. If you've had a very high recent exposure, maybe through sex or whatever exposure mechanisms that you think, perhaps through unprotected sex, all right, which might be common, which is very common in our society today. Or maybe your condom broke while you're having sex. Or maybe you've shared needles. Then you need to ask about PEP, which we call post-exposure prophylaxis. It's a 28 days course that works best when started as soon as possible and within 72 hours. If you think you've been exposed, please ask for PEP, and you better start it very early. It's used for 28 days. If you start it as soon as possible within 72 hours of your exposure, then your chance of not having the virus is very good. To everyone listening today, you can ask for an HIV test, actually. In many places, it is free of charge. If you go to public hospitals, if you go to primary healthcare centers, you will find it there. Some non-profit organizations give you the opportunity to test for HIV. Many facilities now offer a very confidential testing and self-testing options. So if you want to test yourself at home, you can. Just ask for it and they should be able to help you with those kind of kits. Treat early and live well. If you test early, you start treatment early. In case you're positive, then you can live a normal life like every other person. That way you can protect yourself and the people that live around you.
Wow, wow, wow. It's been so insightful having Professor Taiwo Aremu taking us through the management of people living with HIV, the awareness, and then the anti-stigma. HIV is no longer a death sentence like it used to be. Just do all that you need to do. And then in case you have anyone living with HIV around you, do not stigmatize against them. They are as human as you are.
Stigma is a big issue in our community today. And stigma is actually very harmful than the virus itself. For a lot of people, it is just the stigma of what would people say that kills them even before the virus. So it's a big issue. And because of stigma, a lot of people just don't go for testing. It keeps you from going for testing. Like we said, HIV test is kind of free in many places. But a lot of people will just not take the opportunity to just know their status so they can treat early because they feel someone is watching them. It even makes people delay treatment. So even when they found out that they're positive, instead of going straight to the clinic or asking their doctor or their nurse or wherever, that can I start medication early, they choose to keep it to themselves and not let anyone know. And that also isolates family. In Nigeria, we have a national law that forbids discrimination. Nobody should discriminate against people who have HIV or who are living with HIV, whether at work, in school, or in healthcare. Nobody can discriminate against you. There's a law that protects those who are HIV positive. And so knowing your right is very essential. It's important for you to at least avoid feeling stigmatized. And then that way we can treat each other, we can treat one another with a sense of dignity, and we can save each other's lives. And so if you're watching and you're living with HIV, you belong, all right? You deserve care and you deserve the respect that you truly need, like everyone else. If you're HIV negative, please know that kindness and fact can help protect life. Be kind to everyone, whether they're positive or not. Please note, stigmatization. Stigma is our common enemy. Compassion is the cure for fear, but large in numbers. And that's because our population is very big, right? So if you compare the number of those who are positive to the population, it looks low, but the number itself, when you count, is high. So that means we can reach every community because of that low percentage, right? we can reach every community, from busy parts of the urban city or to the rural area or the villages around us. Across Kwara State, for example, we can reach everyone if we're serious about it.
See you another time on the program. I remain Olabisi Yusuf. Take good care of yourself. Remember, health is wealth.